This is the playlist of DPT first semester anatomy past papers. In this playlist, I will discuss the most important questions that are asked in the GCUF examinations. First question. This lecture is for the DPT first semester students. So let's start. These are the questions that are commonly asked in first semester anatomy. First question is the describe the cranial nerves in details. Cranial nerves are there are 12 pair of cranial nerves. Their names and their details are written in this question answer. Describe the cranial nerves in details. Second most important question is the what do you know about cubital fossa? Cubital fossa is in the upper limb. This is the most important question that are asked in the examinations. The third important question is a patient come to you with the wrist drop. Name the inguinal nerve and also described in course. The radial nerve that are involved in the wrist drop. Name the inguinal nerve and also describe its course. The fourth question is what is plexus? Plexus is a bundle of nerves. Draw and label the diagram of brachial plexus. There are many plexus present in our body. Cervical plexus, brachial plexus, lumbosacral plexus. Okay. In this question, what is plexus and label and diagram? Label and draw the brachial plexus. The fifth question is the a pulse of a person is felt and auscultated at the front of the elbow while recording blood pressure. Name the artery and its relationship with the elbow joint in terms of anterior, posterior, lateral, and the medial. Describe its anterior, posterior, medial, and the lateral relation. The artery we record the blood pressure is the brachial artery. Okay. All these questions are very important asked in the examination. The sixth question is the what do you know about the axilla? Axilla is called the armpit. It is the most important question in the upper extremity, upper limb. Next few other important questions that are commonly asked. What do you know about the app-thumb deformity? This is the deformity of the hand. App-thumb deformity, this is commonly asked. Pivot joint, it is the included in the synovial joint category. Pivot joint. Next we have a extensor retinaculum. Retinaculum covers the tendons in the hand and the feet. These are the important three questions that are short questions that are commonly asked. Number 8 question is name the muscle which form anterior compartment of the arm. Anterior compartment of the arm include three muscles: biceps brachii, brachialis, and the craccobrachialis. Also describe their attachment. Okay. Ninth question is a patient come to you with atrophy of thin arm muscles. Thin arm muscles that are on the thumb side and the lateral hand claw. Name the inguinal nerve and describe its course. The next question is the 10th question. How many intramuscular spaces are there in the scapular region? There are the intramuscular spaces in the scapular region, that is the quadrangular space, and all this in the upper limb. Read from the VT Thuracea. This is the most important question in DPT first semester anatomy. The 11th question is the describe the osteology. Osteology means study of the bones. Describe the osteology of the radial nerve with the help of a diagram. Okay. Radial bone is present on the thumb side in the forearm. Describes its osteology with the help of a diagram. Next, question number 12 is give the attachment and nerve supply of pronator teres, biceps brachii, and subscapularis. Pronator teres help in the pronation, biceps brachii in the supination and the elbow flexion, and the subscapularis in the internal rotation. Give it their attachment and the nerve supply. The 13th question is the damage to which nerve caused the wrist drop? Radial nerve, describe its pathway. The 14th question is the what type of joint is glenohumeral joint? It is the synovial joint. Ball synovial joint with category ball and socket joint. Describe its structure in detail. The 15th question is the define the groove. These are the for the bone landmarking. The term groove, embryology, development of a uh, embryology is the development of a human. And the hinge joint, this is the also a subtype of a synovial joint. Write the characteristics of bronchopulmonary segment. It is present in the respiratory system. Draw and label the diagram. Next question, question number 17. Explain the osteology of the humerus. It is the longest bone in the upper limb. Detail with the help of a diagram. Question number 18 is what are the function of a diaphragm? Name the openings present in it along with the structure passing through these openings. Diaphragm and their openings. Question number 19 is what is meant by axillary triangle? Explain its boundaries and contents in detail. It is in the upper limb. Question number 20 is what type of joint is the shoulder joint? It is the ball and socket joint of synovial variety. Explain the structure of a joint. Question number 21 is explain the nerve supply and action of deep muscles of the forearm. There are two categories of muscles in forearm, superficial and the deep. Question number 22 is give the nerve supply, attachment and function description of the trapezius and the pronator teres. Pronator teres has a role in the pronation, and the trapezius is a triangular muscle. It has the three upper traps, middle and the lower traps, three categories. And the last question is the question number 23, that is most commonly asked. Classify the muscle according to their structure with the help of a diagrams. It is in the general anatomy section. These are the some important questions that are asked in the DPT first semester anatomy. Thank you.